Welcome everyone to Patient Voices Across Europe podcast. In this series, we speak with members of ELPA SLD Working Group. This is our dynamic team of advocates across Europe, committed in raising awareness and driving change around steatotic fatty liver disease, also known as MASLD. In each episode, we bring you local insights, patient perspectives, and solutions from the ground up. Our guests are not just ELPA members, they are change makers working with their communities to shift policy, fight stigma, and empower patients. So thank you very much for tuning in. And I'm extremely happy to welcome in our podcast Sindee Weinbaum from Israel. Hi, Sindee. How are you?
I'm very well. I'm happy to be here today. Thank you for inviting me. Yes, HETZ is an organization that is Association for the Health of the Liver. In Israel, we work with all of the different liver diseases. I joined HETZ about 15 years ago when I was diagnosed with an autoimmune disease, actually. And before that, HETZ was only working with hepatitis and various other viral diseases. And now we work with everything. We work with all the rare liver diseases, patients with cancer, patients with fatty liver disease, and everything else that's part of the liver disease.
So you are very active in different fields of liver diseases.
Yes.
I guess you're helping also people in different age groups. But maybe before we dive into that, tell me a little bit your personal experience with this association, or maybe if you want your personal experience.
I can tell you why I joined the organization, because I had a very difficult journey until I was diagnosed with my disease. I have a rare disease, and when I was diagnosed, it took me about 1.5 years of being really, really sick, until I finally found the proper hepatologist that was able to diagnose me quite quickly. I was told all kinds of different things, and I decided to take it into the right place and try to help people that needed my help to not go through what I went through. I want people to be able to get diagnosed properly, on time, not to suffer. These are important things. People need the support. Families need the support. I know what my family went through also. While I was really sick, I was in and out of the hospital. It's not a good situation to be in. I don't want to see other people going through these things. And this is what I do. And I took it to a better place. I'm helping others. We've developed support groups for many of the rare diseases, for patients with cancer, for patients with fatty liver disease, things like this. These children, pediatric diseases. This is really important for people to get the support that they need, and the families around them. Together, as I say always, we're stronger. And this is something really important to me and very down in my heart, so yeah.
I see your smile on your face, so I'll just continue with this topic of children and, young population.
Children a lot of times are obese. They don't do enough. They don't have enough physical activity. They sit across their screens and they don't play. They play games on the computer or on their phones, and they're not doing things that they need to do. In Israel, children do eat healthier. For the most part, they're taught to eat healthy. We have all kinds of different things that we do in schools, and we have a video that we made, HETZ, that is an animated video that children really like to see it because it's funny, it's neat, and they can look at it and they don't think it's something to teach them how to eat, but it really is helping them.
So you really dive into the right terminology, right? You amended the terminology for an audience, which are children.
Sure. Mm-hmm. And they look at it and they see what they shouldn't do. It has a picture of a fatty liver, and it's sitting on the chair, and the children are, just blah. And then all of a sudden they're doing things that they have to do. They're doing physical activity if they walk. Children do these things. You see them running, you see them going around the sports arenas and things like that. This is something that's amazing. They're taught this in school in so many different ways. I can even give you an example from their English books. They're studying English, but the vocabulary is about food and how to eat healthy, about the pyramid of what's healthy to eat and how you should eat, how the food should be divided in your plate. These are things that are really important. And in gymnastics, they learn what they have to do to stay healthy. Also, this is something that's really, really important, and they know that. And, this is something that in the school system, young adults, young teenagers, they're taught that their BMIs are too high. They're tested, and their parents get the reports, and they tell them what action should be taken. This is something that, they don't have to do it. If the parents don't consent to it, they can't do it. But most often, the parents do consent to it because the parents also want to know what their children are and how they are and how they're going to proceed with their lives and how they're going to stay healthier. I think it's very important also that the different health groups in Israel have given out lunch bags for children. And on the bag, you see pictures of eating healthy and you see fruits and vegetables. This is amazing. This is something that, even though it seems something very silly and just something very small, if children see this, they're going to want to eat healthier possibly. You have to think of it in many different ways that can really help them do it. You want to keep their weight down. You want to keep them healthier. And this is helping them very much. A lot of the times, parents, the adults, learn from the children.
That was my next question, because as a child, of course, you have parents that are, let's say, affecting also your way of living life.
They have
right?
unhealthy eating habits that they were brought up with. Forcing children to eat is not something that's done today. When I was a child, I think when you were a child probably too, finish your food. Don't leave it on your plate. And I say, you don't have to finish. You can eat what you need to eat. You don't have to eat more than that. You have to keep the sweets down. You can't eat a lot of sweets. You have to teach them how to eat properly. The amounts of the food that they eat. It's not to not eat sweets at all. Children are not going to eat sweets. But when they eat them, they have to have it in minimal amounts to know when they can and when they can't and when it's too much. I think that's very important, and this is something they have to be taught. They don't learn it just like that. And parents will learn from the children. We have a system in Israel also that I think children see it maybe more. They notice it about labeling different foods. There's a green label for healthy foods. You don't see the green label a lot of the time because most foods are not healthy. Even things that people don't even think that are not healthy. If you think tomato paste, what could be not healthy about tomato paste? That you make your meatballs and tomato sauce with, you put it on your pasta. But then it has too much salt or it has too much sugar in it. These things, people don't understand that. It says it, so children ask questions. When they see something that they'll ask. If you have all the different carbonated drinks that have so much sugar in them, children have to see that. They have to know the limit what their intake is. So these are things that are good. I think that there are a lot of children that are obese. A lot of children that are obese have fatty liver disease already as children. This is something that you have to take into account. There are many other diseases that are found also by accident a lot of the time because of the testing. But we have to test the children. We have to know what's going on with them. We have to have the parents have to help them with it. But it goes around in circles. It's something that...
Yes, so you're saying like prevention, early diagnosis, also health literacy, right? It's important.
Yeah, because when a child that's 12 or 13 sees that their BMI is elevated, that it shouldn't be that high, they have to do something to change it, and they want to change it a lot of the time. They want to be healthier. They want to be active. They just need the push.
And you certainly gave us a lot of good practices from your country. But Sindee, is there maybe something that it's not working well, or maybe that you are struggling as a patient association?
Problem.
What kind of support maybe you need?
A major problem with the GPs, the family doctors. The family doctors, a lot of the time, they see the blood tests, or they don't send for blood tests even. But when they see it and they don't even actually say anything to their patients, they don't send them to specialists. They see the liver enzyme are elevated, but they don't really take care of it. This is something we're trying to work with the GPs to do, because that's where it starts. Because if patients don't have the blood work, or if they don't take that into account, that they're not doing very well, it's not going to work. It has to move forward. They have to make a change. So this is something that we're really trying to get the family doctors involved in that. It's a difficult thing to do. The adults really need that, and they have to be sent to dietitians. Anybody can go to a dietitian in Israel. Our health system is an excellent health system. Nobody's prevented from going to a specialist. They can be sent. They can be. It's all amount. It's a problem of the funding, the money.
Since you mentioned dietitians, my next question is about multidisciplinary team. How does this, concept work in Israel?
Depends on who your doctor is, unfortunately. When you have a family doctor that sends you on to a dietitian because a specialist sent you, even because being sent to a specialist is very easy. Anybody can go to a hepatologist. And You just need the right person to send you to them. Or if you go privately even, which is not supposed to be done, but it's done privately in the beginning and then go through the health system. Getting to a dietitian doesn't cost anything. Anybody can go to a dietitian once a month. And once somebody is there, somebody that has a problem, they're taken care of. And that's something that we need to have done more.
And what about other specialists like psychologists, physical therapists?
If you need it, everybody's sent. Our medical system, you can get whatever help you need. Even medication. Not all the injections are included for reimbursement that help today, but medications, everybody gets their medicine. Nobody is denied medication in Israel. You don't have to be wealthy to get your medication. So,
Sindee, thank you very much for sharing all of these informations with us. I see that you are doing a lot of things, and you are certainly one of the most passionate advocates. You are part of our SLD working group. So maybe tell me a little bit more about this involvement in this working group. What are your feelings? What are your thoughts?
I think there's a lot more that we can do. I think we all have to work together on a project where, for mental health. Mental health of patients that have fatty liver disease. They really need it, and I think that's an important thing that we can really work on that. Like you said before, psychologists. I think that helps a lot of people that need the help, and this is something I'd like to see more of. I think that's a good project for us to work on in the near future.
And you mentioned also mental health for caregivers and people around disease, right?
It all goes together. It's not just a single person, it's the entire family. It's the friends, it's everything. It's the teachers. Even teachers have to be taught how to act with the children. When you see a child in school, I'm going back to children, sorry about that. But when you see a child that at home maybe eats properly, but when they're not in their system, their basic area at home, and they're at a party or something like that, and they just gobble because nobody's looking at them. And they're obese. They need that help. We have to get them psychological, mental health help. Mental health is a really big issue there.
This is also a topic that we discussed in our ELPA podcast, Small Steps, Big Changes, with Professor Shira.
Yeah.
We discussed emotional eating.
See that happening all the time. And even in school, when kids have their snacks that they bring to school and their parents don't even know it a lot of the time. And they bring these fattening snacks that are full of fat, and it's not good for them. Fat and sugar and chocolates, whatever they take with them to school, and the parents don't see it a lot of the time.
A lot of work for all of us.
But that's mental health once again. Yeah.
But thank you very much, Sindee. I will give you the floor for like a final statement, since these are the series for giving floor to voices of patients. So anything that you would like to share with the audience?
Let's work together to make our children healthier. I think that's something that's so important.
Thank you very much, Sindee, for being with us.
Thank you.
Thank you very much for tuning in, and we see you soon with the next episode. Bye.
Bye-bye.